talk about what primary care looks like during the COVID-19 pandemic and the importance of keeping in touch with your primary care doctor. Today to talk with us about it is Dr. Sonia Dar. Thanks for joining us today, Dr. Dar.
Thank you for having me, Jillian.
Now, I also want to, before we get into some of the questions, anyone who might be tuning in, feel free to leave comments, questions in the comments section. We'll circle back around at the end to get to some of those questions. Dr. Dar, first, just can you talk to me about what changes have been made since COVID-19, how primary care has changed, and where the offices are at right now, whether they're open, whether they're closed?
Yes, so we are absolutely open. Our offices are functioning like the normal hours that we would, except that we're doing mostly everything through virtual visits. So telemedicine has really come to the forefront at this time, and we're doing telephone and video visits. There's so many different platforms out there that we can do video visits on. MyCare is linked right through our electronic health record, and it can be used right from your own phone, which is a great source for patients because they can check themselves in on that and get their own after-visit summary on that as well. There's other sources as well, and I know there's some patients out there who are afraid that they might not know how to use a video visit because they might not be adapted electronically, but they're as simple as sending a text message to your phone, you opening the link, and then before you know it, we're face-to-face like this over video. So yes, we are open, we're functioning. It's really important to remain in contact with your primary care doctor.
And you mentioned one or two of the resources people can find on MyCare. Is there anything else in addition that you didn't mention there that people can find on that app that might be useful to them?
Yep, so you can see all of your medications, any blood work that we ordered will show up on the MyCare app. You can review all of your blood work. If you have questions about anything, you can send emails directly to the office and directly to your primary care doctor. So it's really a great resource for patients and for us as well.
And you mentioned telehealth, telemedicine. So many people have been utilizing that since the pandemic began. How do you decide when to see someone over telehealth and when it might be necessary to bring them in for an in-person visit?
Right now, it's up to the provider discretion who we'd like to bring in to the office. Here at our office, we're really not bringing in any acutely sick visits, especially with respiratory symptoms. We're trying to do that all virtually. But we are making some exceptions to the rule. For example, if I'm having a difficult time managing someone's blood pressure from home, I might have them come into the office so we can get accurate blood pressure checks. And then, of course, we're making exceptions for well child checks as well.
Now, should adults still schedule their well exams and routine health screenings at this time?
It's still important to remember your annual screenings because remember, at those screenings, we're doing cancer screening, depression screening. So those are very important things to still remember to do.
I think a big question for everyone right now is when and if they feel they should need to make a visit in person. I know that each office is different. You're a primary care physician at Ridgeway Family Medicine. Can you explain what your office has been doing to protect the health and safety of patients?
Yes, so every individual that comes in to work, so the entire staff here, prior to coming in, we need to log in online and do a symptom check, and then we'll get the okay to actually come into work. Once we get here, we have to show that to somebody who's waiting at the doorway. We all enter in through the same doorway. We all have our temperature checked before we are given the okay to actually start working. And the entire staff is doing that. We're all wearing protective equipment. My nurses are out there with their masks on for 8-9 hour days. And we're practicing hand hygiene. So we really are taking those precautions. And then if we do have a patient who has to come in, we're making sure that we're checking them in while they're still outside. A nurse will greet them at the door and lead them directly to the room. So again, they're not running into other patients or even other staff members when they are here.
Okay, so I would assume that means is the waiting room closed off at this time? No one's having to wait, and are appointments at all staggered to make sure folks aren't running into one another?
If at our discretion we decide we are bringing somebody into the office, there will be a nurse waiting for them. So again, there's nobody sitting in our waiting room.
Okay. And anything else that patients should expect when they come into the office? I know you said they're going to meet them right there. Any other protocols being taken or something they would need to do before coming to the office?
Yeah, so, calling before you get here, so again, that we can check you in while you're still outside and in your car. Everybody needs to be wearing a face mask upon arrival, and we've got our hand sanitizer station right up at the front. So sanitizing your hands upon entering, and then just following the directions that the nurse is giving you in terms of going into the room, waiting in the room before you're being discharged from practice, because again, we're leading you out so that there's no, you're not waiting at the front desk to be discharged.
Okay. And again, I know that every office is a little bit different. Are you taking temperature at all upon arrival?
We will be taking temperature once people start coming into the office.
Okay.
And our next phase of having patients come in.
Sorry, repeat that last one.
In our next phase of having patients come in, what we plan to do is, on any given day, we might have one provider continuing to do telehealth visits while another provider sees patients maybe in every other time slot. And so again, that's to ensure that patients are not crowding the waiting room and running into other patients.
Okay. And you're a mom. So not only are you a primary care physician and you're worrying about the safety of others and caring for others, but you're a mother too, which gives you a bit of a unique perspective, I would assume. Can you talk to the importance of bringing children in for annual checkups and keeping them up on their vaccines, regardless of the pandemic going on?
Yeah, absolutely. So my daughter just turned 2 last weekend, and I took her for her 2-year-old well child check just last week, and that's an appointment that I would not have missed. I know we're all focused on the coronavirus, as we should be, but let's not forget about the other pathogens out there that can affect our little ones, like polio and hepatitis and meningitis. And so it's still important to keep up on these vaccinations and make sure our little ones are growing. And my child's pediatrician's office, they did a great job. They checked us in from our car. The nurse met us at the doorway. She took both of our temperatures and led us directly to the patient room. And so I felt like it was a very safe environment and it was a good experience. And again, I would not have missed that. And I think it's important also, I'm a family physician, so we see pediatric patients as well. And we are still seeing well child checks up until the age of 5. We're still seeing groups between the age of 10 to 13 for their annual physicals and 16 to 18. And those are groups where we have routine immunizations. But I think the other importance of that is, especially the groups 10 to 13 and 16 to 18, these are groups where when they come in for their well child checks, we screen for depression. And right now, with children being home from school and missing out on their friends and significant events, I think that's an important thing to bring your children in for so that they can be screened for that.
Yeah, I think that's really important and a great note to touch on. Now, if anyone's looking to come in, schedule a visit, what are the next steps for them?
So you call the office phone number, and it goes the same way as it usually would. We'll find a time slot for you. And again, we'll usually do a virtual visit unless your symptoms require you to be in the office. We're really not seeing any sick patients in the office, and that's to protect our staff and other patients. But again, you can schedule your office visit like you routinely would, but it'll be virtual.
Okay. Now, one extra thing I want to bring up, I know we talked about this briefly before our call here, was the Kawasaki disease and how it's related to COVID-19. It's something that's been coming up a little bit more in the news lately. Can you shed a little light on that?
Yeah, so we're seeing something that they've termed pediatric multi-system inflammatory syndrome, and that's presenting itself very similarly to a disease that we already know called Kawasaki's disease, which is an inflammatory response. So after an infection, the body responds by increasing its inflammatory markers. And what they're seeing is children are having this after being diagnosed with COVID-19. It's rare. I want to point out the fact that it is rare. The signs that you want to look out for are fever, rash, a child looking very lethargic, possibly having some known exposure to coronavirus. But again, most children that we are seeing with this are recovering just fine. But it brings home the fact that even children are not immune to this. And so going forward, hand hygiene, face masks, social distancing are still going to be crucial.
Okay. And I just want to ask, kind of open the floor, do you have any advice for anybody at home? I know everyone's taking this pandemic a little differently. Just kind of, I guess, words of advice for them if they should be continuing their appointments, whether or not they should be coming in if advised to do so as well, and the importance of that.
Yes, so I know, it's been a frustrating and a grueling time for everybody, but I want to point out that, at least here in our office, we're taking all the necessary precautions to keep it a safe environment, and it is very safe. I feel safer coming here than, sometimes going out to get my groceries. So it is important to listen to your doctor. If they feel like you need to be seen in the office, should be seen in the office. And again, remember that they're doing everything in their power to make sure that patients are staying safe. It's not a time to lose contact with your primary care doctor. It's not a time to stay at home suffering. If you are suffering from some illness, we can still treat you again over virtual visits. And if we cannot do it over a virtual visit, we can at least guide you to go to a place that can take good care of you.
Awesome. And there's one Facebook question. I am not sure how to pronounce this word, so I'm going to give it a go. Let me know if you can help me out here. Someone asked if a home oximeter is recommended. Can you explain what that is and kind of respond to that?
Yeah, so that's the little device that you would put on your finger to check what your oxygen saturation is at. And there are a lot of people who, if they have been exposed to coronavirus or they're having the symptoms of it, have been using that at home just to ensure that their oxygen levels are being maintained. Though it has been recommended by some people, I do find that sometimes devices like that cause more stress than provide any sort of great benefit. You really just want to monitor your symptoms, monitor your breathing, and again, stay in close contact with your primary care physician. I know in the Rochester Regional Health System, any patient who we think or suspect might have coronavirus, we are in close contact with those patients, sometimes calling them up to twice a day to check in on them, check in on their symptoms, to make sure that they're getting the care they need. So as long as you're in touch with your primary care doctor, a device like that may not be necessary.
Dr. Dar, thank you. Is there anything else that you want to add that we haven't touched on?
I think we covered everything. And again, I just want to, stress the fact that we are still here, and I don't want patients to be suffering at home. We've seen an increase, especially in anxiety and depression from people being quarantined, and that's stuff that we can talk about over a virtual visit. So make sure you get into contact with your primary care doctor and seek the care that you need and you deserve.
Thank you so much for joining me this morning. Remember, everyone at home, Dr. Dar mentioned the My Care app, which is beneficial in downloading before you might even have to schedule an appointment or get yourself in the door. A lot of useful information on that app, so make sure to download that. And Dr. Dar, again, thank you for joining us. Everybody else out there, and Dr. Dar, yourself included, stay safe and healthy.
You too. Thank you. Safe, everyone.